the nurses, again, as I mentioned, they are the backbone of the healthcare system, and they have been advocating for Medicare for All, the strongest, the hardest. They are on the inside and they know what needs to be done. So nurses have long been they're spice to this system, and they work long days to ensure the well-being of others. Notice in our earlier conversations about this, it was talking about bedside nurses. That is especially where the shortage is going to be. That's where that is going to show up. And they are underpaid and they are overworked. They've even advanced proposals in making positive changes, even though they are overworked and underpaid in healthcare, because they do care overall for the status of humanity and what is happening and not happening in the American style of healthcare. And so, for example, the National Nurses United, let's put this up. I mean, there they are. They've been on the front lines. I've been on the front lines with them for over the years, for many, many years, and I'm glad to see that they are still out there. Commit to take action on Medicare for All bill introductions. Ask your member of Congress to become original co-sponsors of Medicare for All. So they're fighting both globally in terms of the United States as a whole, and they're also fighting in individual states, and California being one of the major states. Now, astronomical healthcare costs and lack of access continue to drive individuals, families, and businesses past their breaking point, while insurance companies continue to soak up billions of healthcare dollars. Medicare has provided guaranteed healthcare for millions of seniors for more than 51 years. It's time we have a Medicare for All single payer healthcare system that would end health disparities, effectively control costs, and assure that everyone has equal access to an excellent standard of care. This comment is coming from the National Nurses United. Let me just go ahead and say amen underscore and bold it and thank the nurses for what they are doing. And so as nurses and everyday people continue to advocate for a better system, it is politicians who continually, absolutely not only do nothing but exacerbate the system, or the situation, I should say, because they're answering to their owner donors. All they do is smile about healthcare. They make fluffy statements so that they can get reelected. They don't want to offend the owner donor class. They make promises made, so many promises unkept. Politicians like Representative Pelosi, you remember this?
Not a big fan of Medicare for All. I mean, I welcome the debate. I think that we should have health care for all. I think that the Affordable Care Benefit is better than the Medicare benefit, but it is expensive. Who pays is very important. What are the benefits?
She's talking out of both sides of her mouth because we all are paying right now. We're paying for a product, a service that is not optimal. We pay more for healthcare in this country, and we have worse health outcomes than any other industrialized nation. So, Representative, the benefit would be in eliminating a commodified healthcare system that steals billions from people and leaves nurses overworked. The benefit would be that nobody would be underinsured and uninsured. The benefit would be that as a hegemonic nation, everybody in this country should have healthcare. That's what the benefit would be. And it would help to promote peace of mind for those communities currently, those people who are currently underinsured and uninsured. This graph right here, team, let's put it up. More than 2 of 5 working age adults are inadequately insured, don't have proper healthcare insurance. How can we do any other thing personally or professionally if we don't have healthcare and if we cannot guarantee in some way that we can deal with routine things that come up just by being human? Jackson, your thoughts?
Well, and not even just in terms of how expensive it is and how much the costs continue to rise, but just kind of like in a way like the gamification of the market, to where like every year it's kind of like, oh boy, like I get to pick which set I get and what I'm not going to get covered versus what will be covered. And it'll be hundreds of dollars a month, which is a considerable payment for something, especially if you're not sick, that you likely won't use. I mean, maybe you'll use it, but not enough to be paying $200-300+ a month. So for something that, it's a new year, got to change it, got to go through the sign up process once again, unless you have a good corporate job that provides it for you. But more and more,
it's onerous. The paperwork is onerous for the individual, for businesses, small businesses. I mean, I was just talking to a business owner a few days ago that was saying that they can't afford it. Businesses want Medicare for all too.
Yeah.
This absolutely makes no sense. The Democrats are complicit. The Republicans show enough are complicit. And we sick and tired of this foolishness in this country. America, you need to go ahead and rise up and stop playing games with these fools. We're gonna keep talking about this because y'all know how I feel about Medicare for all. You know how I feel about Medicare for all. We need to have it. We got to keep fighting for it.